Welcome back. We're continuing the news. We flip the script in this evening's edition of In Their Words. Instead of vocalizing their opinion on health and wellness issues, students of New Providence Primary in Kingston had burning questions for the minister. Here's Carrie Ann Simpson.
For some, it was nerve-wracking, and for others, excitement. It was all things health and wellness for these primary-level students who wasted no time in getting into the meat of the matter with Health Minister Dr. Christopher Tufton.
What are some of your responsibilities as the Minister of Health?
My responsibility is to encourage, advise, and motivate Jamaicans to live a healthy life, to ensure that to the extent that you need medical advice, you need a doctor, a health center, you need a more advanced service, operation, surgery, whatever, that the facilities are there to give you the support.
So do it take a lot of work to become the Minister of Health?
It's an essential service. So if you ask me if I work hard, you have to. Not just me, the doctors and the nurses, all the others.
What do you think about the health of Jamaicans right now?
Jamaicans are primarily sick than they are healthy. Now, that is a profound statement, and it means different things to different people. It depends on how you interpret sick. Too many Jamaicans have at least one condition, and the average Jamaican is expected to live to see 75 years. What we find is that more Jamaicans are getting very sick long before, and more Jamaicans are dying before that.
Because of the current heat wave, what do you suggest for persons to do?
The best advice to a heat wave is to avoid being in the sun and rehydration. Drink plenty of water.
Why are public health facilities lacking in medical equipment, and why do you refer patients to other medical facilities to carry out a certain procedure?
It is the way the system is structured in order to ensure that everybody gets served. You put certain specialties in some areas, and then you refer people to where the expertise is present.
And when asked if Jamaica is ready for another virus outbreak, Dr. Tufton had this to say.
Nobody wants a crisis. But if you have one, the government has a team of people who can respond. So we prefer not to have it, but we are prepared just in case.
After the drilling, a word of advice from the health minister.
You all represent the future, and I just want you to leave here today to know that any of you can be the next Minister of Health, right? Any of you can be the next engineer, doctor, nurse. Any of you can be the next big businessman. In other words, if you put your mind to it and work towards it, you can achieve it, okay?
Carrie Ann Simpson, TVJ News.